The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering with gum disease. My first guest is an expert on the topic, San Diego dentist, Dr. Patterson. Dr. Patterson, welcome to the program.
Thank you, Randy. I'm real excited to be here.
And before we get into today's topic, tell me a little bit about your practice. What kind of patients do you see?
Randy, I'm a family dentist. I have people come to me for their checkups. And so that might be small children to older adults and everyone in between.
You know, when I told you, when we met, you don't act like a dentist. You don't look like a dentist. You don't dress like a dentist. You came in here, you're wearing shorts. Do you hear that a lot, though?
I do.
You're a very down-to-earth guy. On your message machine,
I don't know how else to act.
You don't call yourself doctor. And your daughter, I understand, 7-year-old daughter wants to be a dentist.
Yeah,
I think I'm at least like working with you, right?
I think I'm rubbing off on her. She's actually assisted me on some family members that needed treatment on the weekends.
So she's right there with the family members,
yeah.
Wearing a mask and the whole bit. Now, you went to dental school where? In Cleveland?
Yes, I did. Actually, I first got my undergrad training at Ohio State. I'm a big Buckeye fan.
All right.
And came back to Cleveland, where I'm from, to go to Case Western Reserve.
Okay, so let's talk about gum disease. And we're talking about advanced treatment option, new treatment options for people with gum disease. I guess traditionally, how is it handled and what are you doing?
Well, this is a subject I'm really excited about, and I think that it's not well known yet, and it's really a revolutionary process. The traditional treatment for gum disease was painful, and a lot of people...
Which is what? What's
the
traditional
gums
treatment?
Are cut. We are trained to tell the patients that we're just loosening the gums, but the gums are cut and loosened, and the treatment is to get rid of the infection that way. But the process afterwards of healing is very painful, and it takes several weeks to heal from that process.
Okay, so stitches, cutting, they're scraping this bacteria that's on the tooth root.
Yes.
And so now that, for the most part, may be a thing of the past someday. That these lasers are treating that. Is that correct? Without cutting, without stitches?
Yes, partially. And it's an alternative, and it's a painless alternative that I feel people need to know about.
And it works.
It flat out works. I have patients I have done traditional gum surgery on, and I've also done the laser on the other side of the mouth, and I can tell the difference because the laser side is actually healing better.
It's better.
It is.
Really? Interesting. You say from the day that went into your office, this laser, you've used it every day since.
Multiple times per day, yes.
I mean, how has it changed your practice, by the way?
It's changed the way I think about how I'm going to treat patients.
How so?
I am now no longer reticent to do care on people for fear that they might have pain afterwards or that it might be too expensive. This is a treatment that is less painful.
It's more than half the cost off regular periodontal cutting and stitches treatment.
Yes,
is that true?
And every bit as effective without the pain.
Let's begin then with what are the symptoms of gum disease?
Okay.
And what is it? And by the way, is periodontal disease the same as gum disease? Same things?
Yes.
Okay.
Periodontal disease is what most people know as gum disease.
What do the patients call it, by the way?
They say they have some bleeding gums.
Okay.
And that's the biggest sign. Now, let's go through a progression. Gum disease is a progression. It starts out with a little bit of bleeding, maybe when you're brushing your teeth.
What about flossing?
When you're flossing.
But aren't your gums supposed to bleed a little bit during flossing?
No, not when they're healthy.
Really?
What I tell people is if you keep flossing, they should stop bleeding. Too many people stop flossing so that they don't have their gums bleed. But let's go into the progression. First you have a little bit of bleeding, then there's some puffiness of the gums. What happens later that a lot of people regret if they don't go see their dentist, if it's not detected properly and treated, is that they'll have bone around their teeth lost and the gum follows. You start seeing longer teeth that are not nice to look at, no longer as attractive as when maybe they were younger, and they start noticing it in pictures. And
so this is a bacteria under the gum line? So I understand
yes, it is.
I mean, could you have a white top, but underneath you've got this?
You could have somebody with very nice white teeth and just slightly puffy gums, but if the bacteria is under the gum line, it's going to start causing bone loss, and then again, the gums will gradually recede, and some people think that's just part of the aging process, but it doesn't have to be.
Really?
You can have that beautiful smile with a nice white teeth and no spaces between the teeth well into your 60s or higher if you are able to keep gum disease out of your mouth.
Okay, now is this true? Okay, so I look it up on the internet, anticipating this interview. About 18 to 20 million Americans have either upper or lower denture. Does it all start with gum disease?
That's a very interesting concept. It is true. It might start with just a couple of teeth, and then unchecked, they have the gum disease spread throughout their mouth. And I said before, it doesn't hurt a lot, but they slowly lose the support, the bone and the gum around their teeth, and then pretty soon they lose all their teeth.
So the tooth starts to get loose.
Absolutely.
Okay. Is it the body's way of almost rejecting the tooth?
That's a simplified way of looking at it, but when the support, the gums shrink down and the bone melts away from the gum disease process,
okay,
then the tooth just gets loose from not having anything holding it in there. It's like building a house on sand. You can have a pretty white smile for a while, but if the gums, the support is not there, you're going to lose them.
Okay, so bleeding gums is, because I interrupted you, but bleeding gums, puffy gums, what are the other symptoms?
Then we start seeing spaces between the teeth because of that recession of the gum, and then we start having loosening of the teeth, and then that gives way to acute situations where a patient has swelling and pain, and they know they have a problem then.
Could hot and cold sensitivity not be just a cavity? Could be
very much
this?
So.
Why? That's what I'm wondering.
I tell people every day, when you have gums that are not healthy, quite often that is what's making your teeth sensitive. And then sometimes, instead of looking farther for a cavity, if we don't see one, we will clean their teeth or get their gum health in order and ask them then how their teeth feel. And quite often, their teeth feel fine.
Is it because, okay, now you describe pockets, and we've talked on the phone, and I'm not sure I understand. Okay, so when you go in, your general dentist will say you have pockets. I mean, how does somebody, what are they told?
That is the loosening of the gums, and when you have that loosening of the gums, we take a dental probe, as many people are familiar with, and we can probe deeper between the gum and the tooth when you have loosening. And we call those loosened gums pockets. Pockets for food to get caught in. It gets harder to clean around the teeth because everything gets caught in those pockets, and that's where the bacteria breed.
So this laser, so I understand it correctly, it goes in, kills the bacteria. Is that right?
That is correct. And I talked about a dental probe. Well, the laser is very much like a probe that's connected to the laser apparatus. So we put this thin little probe, slip it down between the gum and the tooth, and then we hit it with the laser, and the laser energy gets rid of the bacteria, sterilizes the pocket, and tightens the gums. And the whole process is painless.
So somebody watching this, and they have those symptoms, okay, the bleeding gums, bad breath, things like that. I mean, what do you tell them? I mean, what do you say to them?
I tell them that this is a progression. This is going to get worse, and you should treat it now rather earlier than later. If we can do the treatment now and intervene, then it's so much easier on them. They feel more energetic. They actually really feel better about themselves. Their smile looks good. And it's really something that they should address early on rather than wait till it's too late.
Okay. Again, going back to when we talked on the telephone pre-production meeting, one of the things that you say is that if there was an infection in any other part of the body, you would go to the doctor and take care of it. But because it's an infection in the mouth, people do nothing.
Randy,
elaborate on that.
Randy, this goes back to, in my experience throughout dentistry, knowing that people are anxious about coming to see us. And that's why I love this laser process now, because after they've even tried just a little treatment with the laser and realize it's not painful, people are afraid of pain. Do you like having painful processes? So, and all their past experiences with seeing dentists or having gum treatment, if they're in that category, they know that there's some pain involved maybe afterwards. Well, with this process, I feel I can offer this treatment with the laser, and they don't have to worry about pain. So the anxiety...
You say they go home with like a Motrin or an Advil or whatever.
Absolutely.
Is that
Most
right?
people don't even need any pain relief afterwards. But over-the-counter pain medicine like Advil, Tylenol, is all that patient needs that first night.
You said, look, what I want to get across is that gum disease treatment doesn't have to be painful.
That's why I'm so enthusiastic about the gum laser treatment, because it doesn't cause pain. I can offer something, I'm a dentist, I can offer something that will not cause pain. Most people.
Well, causes some pain. I mean, you're gonna, so we don't have to have disclaimers
Randy,
all over this.
You might need an Advil or a Tylenol.
All right.
That night after my treatment. That's it.
Now, in the old days, because you said you did the older procedures, or the procedures, and I shouldn't call them older. I guess they're being done every day. You scrape. Okay, so there's this bacteria, and I want to understand this. So there's bacteria on the teeth underneath the gum line.
Yes.
And you had to pull the gums back or cut them back and scrape it off.
The gums are loosened.
Is that what
and cut.
root planing is? Is that what that is?
That's the first procedure. We call that non-surgical, and we do that. But then it often leads, due to failure of that treatment, it leads to gum surgery or traditional surgery where the gums are cut and they're loosened, and then the roots are cleaned, and then the gums are sutured back in place, and it takes at least a month to get healed up. And,
very sore to eat.
Very sore.
There's stitches in the mouth, is that right?
Oh yeah, and sometimes a packing placed around the teeth to protect the gums that are going to be healing for 3 or 4 weeks.
I mean, I have periodontists now that are saying, Randy, treating gum disease was not a fun procedure. We didn't want to call the patients back the next day, with the cutting and stitches. Oh, yeah. And now with this new laser, they say, and these are periodontists, say it's actually a fun type of treatment. What's your take on that? I mean, you feel the same way?
I'm just, so enthusiastic about this because I call them the next day, I see them a week later, and this is every case, even though I see great results on just about every case. And they, time and time again, they have not had pain from it. They're smiling when they come to greet me, or I come to greet them.
You said they hug you sometimes.
Oh, absolutely. And they're ready for their next part of their mouth, and that's rarely the case in other treatments.
Is it true, like even with cosmetic or veneers, that a lot of people will self-diagnose and think, my gums are too bad to get these procedures? So this would be a good time to do something about it? I mean, don't rule yourself out?
Certainly. Don't give up on your teeth. They were given to you. You have one set. Any replacement we make is never going to be the same. Okay. So I feel that we can treat just about any case, no matter how bad it is.
Let me ask you this question then, because I guess it's tough. You say it doesn't hurt, right?
Right, correct.
Okay. And for smokers, what about smokers?
Well, I'll tell you this. We are health professionals, and we want to maximize everyone's health. I don't condone smoking. I try to convince my patients to stop, but there's going to be people that are going to smoke. We treat them anyways. We have great results.
Really?
Yeah. Even people that don't have the best home care, we still get great results with the laser.
So treatment. No more bleeding gums?
No more bleeding gums.
Bad breath. And how does that? What's the connection between bad breath and gum disease or periodontal disease?
It's back to the bacteria. Gum disease, as a progression, is a bacterial process, and that bacteria gives off a foul odor. And you might not notice it, you the patient, but those around you that are close to you certainly do. And
does it go away right away, by the way? I mean, how soon after treatment can you tell the difference?
Truthfully,
what do they
it probably takes about a week, maybe a couple for overall gum or mouth odor to go away.
Okay.
And we introduce rinses, a protocol where they are using a disinfectant rinse along with the laser treatment. But the gums are instantly healing from the time they leave my office. Within a week, we see a dramatic change, and within 6 months, they're completely as healthy as the healthiest individual.
And not a lot of trips back to the dentist, right?
Not too many. With other laser treatments, quite often they do. With the PowerLase AT by Layers, it's really, we get most of the gum disease on that first visit.
So this is not, I mean, this is an expensive machine, right?
Well, truthfully, Randy, it is very expensive. I'm one of 2 dentists in San Diego that has it, but the results I get, I mean, it's worth every penny.
Now, you brought some photos. We're going to take a quick break, but you brought some photos.
Yes.
What are we looking at here?
Yeah, I have lots of photos. This is a good example. This lady comes back into town. She used to come to me. It's been a while. Hasn't seen a dentist. She's got the bleeding and the puffy gums.
So she tells us. So she comes in and says, my gums are unusually bleeding.
Well, that, and we found it at her checkup. Okay. And, if she had just let it go unchecked, like a lot of people here in San Diego do, she would have had deep pockets, bone loss, maybe lost these 2 teeth.
So when I look at those two red spots.
That's bleeding after light probing of her gums, and that's not a natural response.
So what's causing the bleeding?
That's the bacteria underneath the gum line. And so what we're going to do, and in fact we did with her, is we used the laser, went under the gum line with the laser probe, and the laser energy killed the bacteria, tightened her gums back up in a short period of time.
Interesting.
And she's back where she's from with healthy gums. She's
Very
happy,
nice.
very nice smile.
Okay, so that's a common situation. So it's on 2 teeth. Okay. Now, does it spread to the rest of the teeth?
Well,
Is that what-
absolutely. And that's the fear that I had, was if she didn't do treatment soon, and she didn't have very much time in town. But we were able to do it at her checkup appointment, take care of the gum disease. Otherwise, it would have spread to other teeth in that area, and then possibly throughout that whole part of her mouth, the whole lower arch.
Okay, is this true, or do you find this to be true? I spoke to a periodontist, and he says, Randy, they do the mouth in quadrants.
Yes, that's how we talk about it.
And he says that with the surgery, the challenge he had before he got the laser was that when they did the old, procedure of surgery, et cetera, scraping and cutting, that they wouldn't come back not all of them would come back
I
for
have
their
a case
second
right here.
treatment. Really? And this is
Jane
not a
here.
setup, by the way. So that's what happened to her.
Jane,
Really?
I did surgery on one side, traditional, and she put off the care for the rest of her mouth, which she really needed, for over a year. In that period of time,
Because of the pain associated with the...
definitely, with the long period of healing afterwards. We had some success with that treatment. We saved one of her teeth she would have lost, and we did bone grafting, the whole 9 yards. But I did go back into that area, and I actually went back over that with a laser, because I found that the side I did laser on, after I got the laser and she came back, the side I did laser on was healthier. So I went back over the part I had treated earlier, and we got even better results.
So interesting. Okay, so
Here
you did
she is now.
Very nice. Very nice. It looks like healthy gums. So interesting. Okay, so you did the older surgical procedure. You get the laser. You get her back in. So you were wondering, okay, so how is this going to compare?
Yeah, and at the time, it was early on using the laser. I wasn't sure if we were going to get as good of results.
So
In
were you
fact, we got
surprised?
better. I was a little surprised. In fact, she called me the next day. She had not felt any pain afterwards, and that was a little surprising to me, and I was very happy. And she came back about 2 weeks later to have the rest of her mouth treated with the laser.
All right. Okay, so you have other photos. What are we looking at?
Yes, this is Marla.
Okay.
She had come to me on emergency on the weekend, had a gum abscess, which is puffiness of the gum. She wasn't sure what it was. That's what we found out. It was an abscess, an infection with draining infection around one of her teeth. She might have lost that tooth had she not acted on it. She decided to give me a call. I saw her on the weekend. We used the laser, and as little as a couple days later, noticed a difference. No more swelling.
So this abscess, this was caused by periodontal disease.
Yes.
By gum disease. So you zap it. Am I simplifying it too much? But you zap that disease,
That's about right.
kill it, and it goes away. It gets better.
It's a small probe that's slipped between the gum and the tooth and as far down as the infection goes. And the laser energy is going to kill the bacteria and cause the gum to reattach, to tighten up.
Okay.
On
Now,
the tooth.
I believe this is a fair question. That if it's as good as you say it is, why doesn't every dentist use this, and why are they doing this older surgical procedure?
More
What's your
dentists
take?
will, Randy, and
Okay.
I hope they do. It's such a great procedure. I think that it's just early on. It's an advanced, cutting-edge procedure, and it is going to be introduced more quickly into the way we do dentistry.
All right, we're going to take a quick break, and up next we have one of your, in studio, we have Rochelle, one of your patients. What can you tell us about Rochelle?
Rochelle came to me for a checkup, and she had bleeding. She was surprised, a little bit alarmed, but I told her, despite what you've heard in the past, don't worry about it. We can treat this with very little, maybe no pain. And she had bleeding, puffiness of the gums, and a deep pocket. We used the laser in a local part of her mouth, a small portion of her mouth that needed it,
Okay.
that same day. And I'll let her tell you. how
All
she
right,
felt.
okay, we'll meet her after this. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, more about gum disease, a new treatment option for people suffering with gum disease. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about gum disease, new treatment options for people that are suffering with this. And with us, we have an expert on the topic. He's using a laser. He's wiping out gum disease in San Diego County, Dr. Patterson, and one of his patients, Rochelle. Rochelle, thanks for coming on the program.
Thanks for having me.
Now, tell us about Rochelle.
Rochelle came to me for a routine checkup. She didn't realize she had anything wrong, and I found deep pocketing, some bleeding, and she had gum disease. And I was a little apprehensive at first to bring it to her attention because I knew she'd had a bad experience. She had lost a tooth about 10 years earlier from gum disease. She had been down that road. She had a dental implant placed. Fine. But I did tell her, and she was freaking out at first.
Really?
You?
A little.
Okay.
And so I tell her things have changed. Now we use a laser. We can go in there. We could do it today. You'll have very little pain afterwards. Some people have no pain.
What were you worried about, by the way, when he told you this?
Pain.
Was it painful?
The laser?
He's been saying throughout the whole show, and we'll put you on the spot here. He said, they don't really complain about pain.
I have to admit, I'm a dental phobe. I do not like being in a dental chair, and I was very apprehensive from the moment he says, "Oh, I found a spot." I'm like, "Oh no," and he put me at ease quite quickly, and he used the dental laser on me, and The laser.
Right, okay.
I was very surprised. I have a background in dentistry. I've known Dr. Patterson for 20 years, worked with him.
She does take care of her mouth.
And I have great home care. However, this came up, and I was very apprehensive about getting the treatment done, and he put me at ease, and he said, "I have my laser right here. We can do it. You can go home today, no problem."
So it's that fast?
It's just like that.
Let me tell you what we did. Okay. So we got down to it. We numbed her area very gently and did the laser periodontal treatment. And she left. That night she told me she only took an Advil and was fine the next day. And I saw her the following week, and like all the other cases I've completed, there was already a lot of healing taking place and another success.
Now you say she's like, and why she's here today, because she's like a typical patient.
Absolutely.
Except for she went in early.
Yes. We caught it at her checkup, and like many people, she wouldn't have done anything about it. She had a little bleeding. She would have thought nothing of it. That's what most people do. And we caught it early. Had we not, 5 years, fast forward 5 years, she might lose that tooth. She might lose that and the tooth next to it, or at least have dark spaces showing in her smile.
Okay.
Not going to be happy with that.
No.
Now, so the experience was good. Well, you already know each other. Tell me a little bit about him, by the way.
First of all, Dr. Patterson is very modest. I've been working with him. I've worked with him over the past 20 years. He is a wonderful dentist. He has such a gentle hand, and I was very apprehensive to go to the dentist, even though I know him, and I know he's worked with. I refer a lot of my friends and family members to him, but myself again was apprehensive, and very glad when I actually did go in and went in just for a routine cleaning. Okay. Just thought, well, it's been a little while, I haven't been in, so it's time to get my cleaning done. I didn't anticipate having laser or anything like that done, and didn't expect to have that type of treatment. And
how long did it take?
It wasn't long at all. It must have been
about 20 minutes.
About 20 minutes.
About 20 minutes?
Mm-hmm.
Now, by the way, I mean, is this true? That people come in, they're going in for a cleaning like her. You tell them, hey, but you have pockets, you may have periodontal disease, and they don't want to hear about it. Or they brush it off and say, okay, well, let me think about it.
Well, it's not the most exciting subject until we start talking about the bad breath it causes and things like that. But so when there's no pain from the chronic condition involved, when they're not having pain, sometimes they aren't interested. But that's our job, is to educate people, and that's what I'm doing today. Gum disease is a serious problem, and it is better to treat it early before it's later on down the road, and we're maybe having to save most teeth, but some teeth are already lost, and we're doing more expensive treatment. Come see us early and get a checkup. We'll see if you might be able to be treated with a laser with a lot less pain.
So a consultation, okay, so somebody watching this, bleeding gums, things like that, they can go get an evaluation. So she was almost headed for disaster, potentially, if she did nothing.
We headed it off at the pass, and look at that smile, huh?
That is a very nice smile.
I'm glad we did.
Thank you.
Yeah.
No, but do you really, I say headed for disaster, but do you feel that way? That means if she did nothing,
absolutely.
She would have been, because you've already lost one tooth.
Correct.
Okay.
And this, I literally had no symptoms. I didn't have any bleeding. When I flossed my teeth, it actually, I had a little tiny sensitivity. I had no idea that it would have amounted to having a laser treatment or anything of that sort.
We are completely out of time, and I want to thank you for coming on the show, sharing your personal story.
Thank you.
Is there anything we haven't talked about it? I got about a minute.
Well, real quick, we haven't talked about, and we should know, that there's a lot of medical problems that can be helped or avoided by having healthy gums. Heart attacks, strokes, diabetes are all decreased. Your chances of those are decreased when you have healthy gums. And
so there's a connection then.
Yeah, but aside from the health things, talk about having a nicer smile and a better self-image. That's important.
Okay, good. So, final message. Somebody watching this, they have these symptoms.
You have bleeding gums. Maybe you have an advanced case and you've already been told that you need gum surgery. You're afraid of that. The cost is high. Get a second opinion. Let's look at all your options. I think the laser is going to be working well for you.
All right. I want to thank you for coming on the show. Great stuff. You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct a friend to it, just go to our website at wellnesshour.com and put in gum disease. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.